If you come to my OPD and if you are a high-risk patient, namely if you have cardiac issues, diabetes, some lung issues or other comorbidities, what we call as in other conditions, in that case a thorough workup is definitely required before planning for any surgery. Hello everyone, I am Dr. Somyaa Khuller, General MIS and Robotic Surgeon from Sakra World Hospital, and I am here today to just make you realize as to what goes through in a surgeon's mind while planning for a pre-op workup for a high-risk patient. When a patient who has various other issues comes to our OPD, we generally take a detailed history, understand what all other issues the patient may have. Suppose it's a young healthy individual, a basic pre-surgical workup is okay, and these workups have also been pre-designed by the hospital to understand that all underlying issues can be picked up at least in such kind of patients. But if it is an elderly patient or a patient with other medical issues, in that case we may have to ask for certain specific tests to understand how fit the patient is to undergo the surgery and the anesthesia. Please understand that the surgery and the anesthesia both are stresses on your body. So to understand if your body can take that stress, we need to understand how fit it is. So for some patients, it may require multiple consultations. Consultation with the cardiologist, consultation sometimes with the urologist, with the pulmonary physician, with the anesthesia people, so that even before admission, we do a complete anesthesia checkup. Post this, sometimes medications are changed a little bit, some pre-optimization or changing of the lifestyle of the patient is done so that we can make sure that the surgery is done at the safest interval for the patient. All this is just to ensure that the surgical outcomes are good. Once pre-optimization is done and the patient gets into the hospital, our effort is that within 1 or 2 days, the patient should go home in a walking state, independently and being able to eat food. So these things are extremely important, and I think it's good for even the patients to understand that there is a lot of thought process which goes into pre-surgical planning. Thank you.